Hello, everyone. My name is Karina Van Hoven, and I am here to talk to you today about vitamin D. Vitamin D it naturally presents itself in food and is added to other foods and can be taken as a supplement as well. Our bodies they take sunlight, usually the UVB rays, and they convert it into vitamin D in our bodies. Vitamin D is needed for the absorption of calcium, and that's its main job in the body is to help maintain the healthy and strong bones. Vitamin D is a fat-soluble vitamin, which means that it dissolves or is stored in the fat, which makes it rare to have a true deficiency because we have so much of it stored within our fat. It's also pretty hard to take too much vitamin D and become intoxicated by it. Now, vitamin D, these are the two charts. The RDA chart is on the left, and that's the recommended daily amount that we should be taking according to our age, our gender, and whether or not we're pregnant or lactating. And on the right, there's a chart of both the RDA and the UL next to it. Now, as I am a 23-year-old woman who is not pregnant, for example, I should be taking 600 IUs per day, but because I do live in a place where the sun is not out as often, I should be taking more than that. And I will get more into that as time goes on with this presentation. Now, here are some sources of vitamin D. Some food sources include fatty fish like tuna, mackerel, salmon. There's beef and liver of animals has a lot of vitamin D as well. There's cheese, egg yolks, and like was stated before, there are foods that are fortified with vitamin D where they add vitamin D into it. Things like dairy, orange juice, soy milk, cereals, those kinds of products. Now, something that I found very interesting during my research is that a lot of your vitamin D can be absorbed by sun exposure itself. Now, most people, they meet their vitamin D daily recommended intake through just simply sun exposure. It's the UVB rays that we absorb and is converted into vitamin D in our bodies. And I found it interesting that that cloud cover reduces UV energy by 50%, and how shade reduces it by 60%. Because growing up, I was told that when you're outside and it's cloudy, or at a beach and it's cloudy, that you can still get sunburnt through the clouds, which I thought was just very interesting, that it actually does reduce that UV energy by so much. Now, this also includes sunscreen. Sunscreen, if it has an SPF of 8 or more, it does block the vitamin D from producing in your body. Something else that was interesting that I found is that the UVB rays does not penetrate through glass, which means that if you're sitting next to a window and you're feeling the sun rays through the window, you're not actually getting any of those UVB rays, and so you're not getting the vitamin D that you need. So that will maybe be an incentive to go outside and play instead of staying indoors. The amount of vitamin D our skin takes from the sun, from sun exposure, is dependent on many factors, including the season, the time of day, the latitude, like where you live on the earth, or how close you are to the equator or not, and also our skin pigmentation. Now, another way that we can get vitamin D into our bodies is through supplementation. People who need supplements, I'll go over a little bit later. But for now, supplementation, there are two different kinds of vitamin Ds in two different forms that we can take in. There's vitamin D2 and vitamin D3. Now, structurally, they are slightly different, but they have the same effect as each other. For example, for preventing or curing rickets, vitamin D2 and vitamin D3 are both identical. So they both will work the same way in that regard. Many older individuals, many older adults, they don't get regular exposure to sunlight because of their jobs or because of just being in the house or what have you. So they have a harder time absorbing vitamin D. And so taking a multivitamin or getting some sort of vitamin D through their diet, they really need that to improve their bone health and to keep themselves healthy in general. Now, as for deficiencies usually only occur as the result of dietary inadequacy, impaired absorption and use, an increase, a requirement, or increased excretion. Those are the ways that our body can become deficient in a vitamin. For example, if your vitamin D intake is lower than the recommended levels, exposure to sunlight is limited, or vitamin D isn't being absorbed or converted properly, that deficiency may occur. Now, some of those deficiencies are listed, mainly rickets and osteomalacia. Those both have the same symptoms, and they both occur at different stages in life. So rickets happens for younger infants or children, and osteomalacia will happen a little bit later, just because of that not getting enough vitamin D. Other symptoms of a deficiency are the muscle pain and weakness, joint pain, bladder problems, muscle cramps. Our bones, they become thin and brittle and misshapen, and that is what can lead to like osteoporosis. Now, toxicity, on the other hand, if you have too much vitamin D that you've taken in, which is rare, it will cause hypercalcemia, which is an elevated calcium intake in your blood. And the symptoms may vary from increased thirst and urination to belly and bone pain to muscle weakness. Another thing that will happen if you get too much vitamin D is the calcification of soft tissue. Now, that is not something that we want. That the calcification of soft tissue it causes the tissue to actually harden. Other things that we've already mentioned, the frequent urination, nausea, vomiting, loss of appetite, kidney problems may also occur if there's too much vitamin D in the body. Now, there are certain groups that are at risk for an inadequacy of vitamin D. Firstly, breastfed infants. They don't receive the recommended amount solely from the human milk. They only receive human milk or breast milk only provides less than 25 IU to about 78 IU. And that is definitely not enough for a child to grow. So in order for them to get what they need, mothers actually need to be supplementing themselves so that the vitamin D can go through their breast milk to the child, and the child will then receive all the vitamin D it needs to grow nice, strong bones. Now, as said before, older adults, they also are at risk for inadequacy because of what we've already talked about. Something that is not listed on here, which I just thought of, is those who perhaps have certain diets may be at risk of inadequacy because they're not eating the foods that their body needs to get vitamins from. For instance, like vegans don't eat meat, and they don't eat fish, and so they really need to be supplementing for sure. People with limited sun exposure or darker skin, or have inflammatory bowel disease or other conditions where their bodies are actually not absorbing fat, including liver disease, cystic fibrosis, Crohn's disease, celiac disease. All of those are examples of diseases that may have an inadequacy in vitamin D. Now, overall health with its relation to vitamin D is that vitamin D, it prevents osteoporosis from happening, which is the loss of too much bone, or it doesn't make enough bone to replace the bone that has a low bone density. So our bodies are constantly trying to break down and rebuild our bone to fortify it and to make it stronger. And without that vitamin D to help the calcium, our bodies will not be able to build that bone density that we need, and will eventually, over time, lead to osteoporosis. This condition is more prevalent in women because they lack the muscle. There's also in older adults and also in post-menopausal women. So a way that you can counter this, for women at least, women could actually go to the gym and lift heavy weights, which will help their bodies create better bone density, which will prevent them from eventually getting osteoporosis if they don't have, if they haven't had enough vitamin D or calcium helping their bodies out already. So going to the gym, always a plus. Vitamin D, it plays a huge role in the prevention of colon, prostate, and breast cancer also, which I found was really interesting as I was reading. It stated that it inhibits tumor angiogenesis, it enhances cellular communication between junctions, and it inhibits mitosis of certain epithelial cells. Mainly this study was talking about breast cancer, but I'm sure it has to do with all of these. Vitamin D is very powerful. It also helps in the prevention of type 1 and type 2 diabetes, and that this quote that I have written here is from something that I read, and it says, evidence indicates that vitamin D treatment improves glucose tolerance and insulin resistance. Vitamin D deficiency leads to reduced insulin secretion. Now, there are many functions of vitamin D with metabolism, but here are a few that I found were interesting. That it is required to maintain normal blood levels of calcium and phosphate. It's also needed for the mineralization of bone, muscle contractions, nerve conductions, and normal cellular function. And as a side note, vitamin D is a blocker for the release of parathyroid hormone. So when our body needs to stop the parathyroid hormone from being secreted, vitamin D helps with the blocking of that. So I found these to be interesting, and also I think I had mentioned some of them before. These are just some fun facts about vitamin D. So sunshine has to reach the bare skin for the vitamin D to actually be activated in our body. It can't penetrate through glass. Fair-skinned individuals, they can go out into the sun for 5 to 10 minutes a few times a week and get enough vitamin D for themselves. Cloudy days or low light of winter, or even sunblock can interfere with the production of vitamin D as well. And the last two I've already talked about with depending on your skin tone, and if you wear sunscreen, it also disrupts with vitamin D production within the body. And these are my sources. They were really awesome. And I hope that you have learned a lot about vitamin D, and maybe perhaps learned something that you didn't already know before. But thank you, and have a wonderful day.